A Northern Kentucky woman just won a battle she wasn't sure would ever end. It's a fight many of you might also experience in your lifetime.
And when Karen Humphreys found herself going round and round and round with her father's health insurance companies over 24-hour care a doctor says that he needs, well, she contacted the 9 on Your Side I-Team for a little more help. In fact, I-Team reporter Hillary Lake got involved and discovered Humphreys' experience is all too common here in the tri-state.
Who I talk to, where they're from.
Navigating the health insurance maze is a second job for this full-time cake decorator.
This is my notes from the very first day we started.
But after 6 months, she's had it.
It's frustrating. I feel like I'm beating my head up against the wall. If I get a different person, I get a different answer.
Karen Humphreys contacted the 9 on Your Side I-Team to help her understand why it seemed like she couldn't get any consistent answers from her dad's health insurance provider.
Now we're 4 months to the day, and we're still getting stupid stuff like, now we need a diagnosis code. Now we need a procedure code.
The 9 on Your Side I-Team discovered Humphreys' frustrations are shared. A 2018 market research study from J.D. Power finds overall customers are less satisfied with insurance plans, struggle to understand how those plans work, and want better customer service.
One of the frustrating things is when you call them, you can't get the same person.
Karen started dealing with her dad's insurance company in January. She's his power of attorney.
Hey. Oh my gosh, you got your Cincinnati Red shirt on.
84-year-old Lee Ampfer is an Army veteran and a retired career lineman for Cincinnati Bell. He fell at his Northern Kentucky home in October and got a brain bleed.
That was a spiral downhill.
I'll give you that one.
But Lee is trying to stay mentally strong. His doctor diagnosed him with dementia in February, then signed an order requiring him to have round-the-clock care. Karen says representatives at Anthem Blue Cross Blue Shield in Ohio told her his policy covered non-skilled in-home health care.
I talked to so many people at Blue Cross and Blue Shield that I didn't believe them. I said, wait a minute, you'll pay for this? I was kind of in shock. That was on January 23rd. I called them back on January 24th and I made them tell me again.
By June, the insurance company had changed its tune, further confusing Karen.
As of an hour ago, now she's saying, well, that might not even be covered. I said, what do you mean it's not even covered? This kind of home care might not be covered. I said, what do you mean? It was covered all the last 4 months. It's been covered. So now you're really backing out?
To make sure Lee got the care his doctor says he needs, Karen dipped into Lee's savings account to pay for it while working with the insurance company to figure out reimbursement.
I don't have a money tree in my backyard. I don't know what they're thinking I'm going to do.
The total out of pocket through the end of June, $65,000.
That's a lot of money.
That's a lot of money. My dad doesn't even know.
The I-Team took this family's story to Miriam Sheline, an attorney at Pro Seniors in Southwest Ohio.
We handle about 6,000 calls in the state of Ohio per year. Probably the largest number is debt and medical-related debt.
Sheline says Pro Seniors also gets calls from families like Karen and Lee's in Northern Kentucky. She has to refer them to legal aid because they're out of state. She says there's no way to make navigating health coverage easier for seniors.
It's a matter of seniors, even when they start enrolling in Medicare, to really understand what their insurance covers and who they need to talk to at each stage.
She also says Karen did the right thing by documenting every bit of communication with her father's insurance company, even though the process was frustrating. Karen was able to show she was told several times her dad's care was covered before she was told it wasn't. After the I-Team asked an Anthem Blue Cross and Blue Shield spokesman about Lee Ampfer's policy, his family got a resolution. In a statement to the I-Team, a spokesman says, quote, "We always strive to provide our consumers with access to the best medical care according to the terms of their health plan. The services in question are not a covered benefit under Mr. Ampfer's health plan, nor are they covered by Medicare. We took a closer look at the circumstances of this particular situation and made the decision to cover the services Mr. Ampfer has received to date." Karen Humphreys is relieved the company is finally reimbursing her dad.
I know they think I'm going to give up. I'm doing it for my dad. I'm fighting for him.
A happy ending to this frustrating story. Karen Humphreys tells me her father received his first reimbursement check from the insurance company last weekend, and a few more are on their way soon. Hillary Lake, 9 on your side.